Nurse practitioners are clinical and professional leaders, and most of their work involves direct service of healthcare delivery where they put their advanced training, clinical expertise, and skills to best use. Many new graduates of nurse practitioner programs feel unprepared to care for complex patients and express anxiety related to the demands of patient service in a fast-paced environment. Nurse practitioner education programs have grown exponentially nationwide, while nurse practitioner residency programs continue to develop slowly. Currently, fewer than a dozen nurse practitioner residency programs exist in the United States. Those that do exist help newly graduated family nurse practitioners practice to their greatest potential.
We felt the need that a primary care nurse practitioner, and in fact a community nurse practitioner, needed to get additional training, an experience or a clinical residency to augment their clinical experience so that they had a better understanding of how to provide care for the community.
A standardized nurse practitioner residency training program, such as the one recently developed at Puentes de Salud, would greatly benefit the nurse practitioner, the institution in which they are practicing, and most importantly, the health and wellness of the patient population and greater community.
The more qualified people we can get into these programs, and the more we can deliver these people out into the community, to the national spectrum, the more we can spread the word about what this program means, and show them that, look, we have this product, we have this individual, this person that is now a much better, much more adept clinician than without the program, without that experience.
As the chronic care conditions increase in complexity, there is a greater need for advanced practice nurses in community settings that care for underserved populations.
We here in Philadelphia, as well as other metropolitan areas, have a disproportionate amount of underinsured, underprovided minorities. And on the global scale of things, it's a significant problem. It's a significant problem for the healthcare systems in the urban areas in Philadelphia, New York, Los Angeles, you can go on and on. And we need programs to develop, programs like ours to cater to the community at large.
Puentes de Salud operates on a multidisciplinary, community-based collaborative model that promotes health and wellness through low-cost, high-quality healthcare, innovative educational programs, and community building. Since its founding, Puentes de Salud has prioritized the development of a comprehensive plan for Latino health in South Philadelphia. This program seeks to improve the quality of care provided to this vulnerable immigrant population by increasing the number of qualified healthcare providers on its staff and ensuring that they receive top quality training. Generous donations enable Puentes to strengthen the health and well-being of the Philadelphia community while providing better outcomes for the individuals served, their families, and the greater community. A generous grant from the Barrow Foundation has helped the residency program get off the ground, but there is ongoing need for continued community support for such programs.